Hi, everybody. Oh, wait, let's see. It should
5
say
o'clock.
live. Here we are. Here we are, everybody. Welcome. It's Dr. Linda of the Vascular Birthmarks Foundation. This is October 2022. We just finished our amazing super clinic at the Beckman Laser Institute, and joining me as we wrap up this annual event is the medical director of the Beckman Laser Institute, world-renowned laser expert, and the VBF West Coast Medical Director, Dr. Stuart Nelson
Good evening, everybody.
of the Beckman Laser. So say hello to everyone, and people will start asking questions, and I'm going to pull it up so I can see you and me on here. Then I know, okay, why is it not popping up? It says we're live, everybody, so we need you to let us know. And let me just get on here and see the questions. Okay, let me switch vascular birthmarks. Here I am, everybody. If you can just let us know that you see us. Ah, there we are. Okay, we got a comment already. Let me turn the volume down. Hello, Ava says hi. Carista Johnson, I see you. Jalen Sebastian, other people are watching. Elida Silva says, hello, Dr. Nelson.
Tell her I'll see her in 2 weeks.
He'll see you in 2 weeks. I see you're all on here, so this is great. Thank you for joining us. Now, today is all things laser with Dr. Nelson answering your questions. Yana is saying hi to Dr. Nelson. Dr. Sophia Cook is on. Hi, Sophia. Rose Miranda is watching. So we have a lot of people joining us. We are actually ready to take your questions, but just so you know, we just finished. We had 120 some clinic appointments, over 35 ultrasound, 27 dental, 16 laser, 30 that participated in psychotherapy. And it was, in our opinion, it was a great success. Next year we're in New York City, so we will see you all. And also we have free laser next month in Boston, and we have free laser in December in Milan. What can be done to take this port wine stain off my face? Good question, Carista. She wants to know what could be done to take the port wine stain off her face.
We don't have a picture, so
Well,
we're going to talk in general terms.
Right.
I mean, present, the standard of care would be the pulsed dye laser, which is yellow light. The yellow light goes into the skin. It's absorbed by blood vessels underneath the skin and converted to heat. You can think about it that at 5 o'clock, a black car in the parking lot gets hot because infrared light from the sun is well absorbed by the black pigment in the paint. So here, the yellow light is absorbed by hemoglobin in the blood vessels and converted to heat, and it coagulates the blood vessels. The laser goes off and on very quickly. It delivers pulses that are on the order of milliseconds. And the reason they're that short is because you want to confine the heating just to the blood vessel itself. You don't want the heat to diffuse in all different directions and damage adjacent skin structures, or more importantly, the normal overlying epidermis of the skin. The dynamic cooling device will help protect the epidermis, but in patients with darker skin types who are tanned, sometimes you can get some injury to the normal overlying epidermis. But that's the treatment of choice. The procedures are performed generally on an outpatient basis. At our institution, we let the patient or the family decide how they like to do the procedure. We do some of them under general anesthesia, like I did this morning. Some we do with regional nerve blocks, which is what we did at the clinic last week. Other patients opt for topical anesthetics. And for the infants and young children, where the cases are so quick and we're concerned about the possible systemic effect of some of these anesthetics, we'll just simply do the procedure by papoosing the baby, making sure we protect the eye, and do the procedure, which just takes a couple of minutes to do.
Thank you. That's a great answer. Now, Sophia just wrote to us and said her daughter had just had a laser and it's blistering. She's a toddler, and I'm now worried about scarring. She's of mixed heritage.
Okay, I'm sorry, I didn't hear the beginning of that, Linda.
Her daughter just had laser and it's blistering following laser.
But there was something about a mixed heritage?
She's a toddler, and the mom is now worried about scarring, and she's of mixed heritage.
So I'm going to assume mixed heritage means somebody with a darker skin type. Please let us know if that assumption's incorrect. But as I just said, with the epidermal melanin in patients who have darker skin phototypes, the melanin in the normal upper layer of the skin will also absorb the light. And even with cooling, you can, in some patients, get some epidermal denaturation, which means you get a little bit of crusting, which usually will heal without sequelae. A small blister can be managed, simply by washing the area gently with some warm soap and water. And I like to use an antibiotic ointment called mupirocin or Bactroban that does require a prescription, or go to your local pharmacy and get some bacitracin. I mean, most of these will heal generally without sequelae. You may get a little bit of hypopigmentation, which means the skin looks a little bit more of a whitish color. That can sometimes persist for a few weeks to a few months, but generally all of these sequelae will resolve spontaneously without any other treatment.
Well, thank you for that. I wanted you to actually answer that before, but you answered it now, that even if it does hypopigment,
It will repigment normally.
it will
Yeah.
get it. But one of the most important things is they really need to use sunscreen and stay out of the sun when this is going on.
That's absolutely essential. I mean, the epidermal melanin will act as an optical barrier, so to speak, because that layer is above the blood vessels. So in patients who are tanned, unfortunately, the laser treatment will be less effective because the melanin will also absorb the yellow laser light, which will decrease the amount of light going into the skin to the blood vessels underneath the skin.
Krista wants to know, does a port wine stain age your skin on that half of your face?
No, it doesn't necessarily age your skin. In fact, patients who we do cosmetic procedures on, for people who've got just blood vessels on their face, spider veins we call them, people who have rosacea, they will actually tell us that their skin feels softer and smoother after they've had the laser treatment. And the reason for that is the light's absorbed by the blood vessels, but some of it is conducted to the adjacent perivascular collagen, and therefore you get a little bit of neocollagenesis. And in fact, there's a lot of physicians that are doing these they're called spa treatments or photofacials or photo rejuvenation. And you can use the yellow light, you can use intense pulse light sources, you can really use anything you want to actually stimulate the formation of collagen. So if anything, patients will actually tell us their skin feels softer and smoother after they've had the laser treatment.
Yeah, I've had a lot of patients say that have had quite a few lasers over their life, and they get into the 4th and 5th decade. They say the side that's been lasered looks like it's had cosmetic surgery.
Yes. People go to med spas and get photofacials, photo rejuvenation all of the time.
So Elida Silva says, I've been getting laser treatments on my large facial port wine stain for 20 years. My treatments are more to control the growth and keep the skin from forming into pork rind texture. That's an interesting way to describe it, pork rind
I'm not sure what pork rind is, but when I see you next week.
Bumpy.
Well, that's totally a different phenomenon. I mean, what happens? And actually, after our good colleague Martin Mim passed away, I actually was looking for a slide, and I logged into one of his talks that he and I had done together many years ago. And I've forgotten that the reason that people get these vascular nodules is that the blood vessels actually grow up into the upper layer of the skin. He actually called it herniation of these blood vessels through the epidermis, almost like you get a hernia in your abdomen. And so that will happen slowly and insidiously over time. So in adult patients, the formation of these nodules, or sometimes people can get pyogenic granulomas, other vascular issues, those need to be treated with the laser. And the laser will do a good job of flattening and smoothing those out. Usually that can be done in just a couple of treatments very easily.
I think I've never heard that, Dr. Mims said that, but that description of it,
It totally makes
like
sense.
a herniation.
Yeah, that's what I remember.
And it's interesting because you see it in a lot, like we just had a 13-year-old that has a lot of blebs come through.
Yeah.
So it'd be interesting to get some pathology on those, when we have our new pathologist, Dr. North.
Well, we can ask Paula North to look
Yeah.
at them now. But
So Roy Britton has a great question. He wants to know if you can compare the Prima laser with the V-beam for adults.
well, they're different iterations of the same pulse dye laser. They're both manufactured by the same company, Candela. They both produce yellow light. They both produce pulses that are on the order of milliseconds. The Prima, being the newer device by about 15 years, it's more powerful. So it puts out higher energy densities And so the advantage of that for someone like me who treats patients under anesthesia or infants and young children is it allows you to do the treatments a lot faster because you can use much higher energies on larger spot sizes. But the real difference between the two is that how the pulse itself is actually structured. So, we're going to be talking a little bit of engineering here, but when we talk about a pulse duration of, let's say, 3 milliseconds, if you look at the current V beam, you see 6 little spikes within that 3 millisecond pulse duration. With the Prima, you have several more spikes actually within that individual 3 millisecond pulse duration. So with the conventional V-beam Perfecta, you actually will see more purpura as compared to the Prima. But they're both producing yellow light. It's just how the light is actually delivered from an engineering point of view is a little bit different.
Okay, so a patient that we saw last weekend, David Vardanyan, he's the one that had that verrucous type of truncal, was on his back, his arm, his shoulder, his torso.
Yes, I think he has, an
angiotensinogen. So he wants to know, first of all, if insurance would cover the ND-YAG. He was recommended at the clinic to have YAG treatments, and he wants to know if he can come from Indiana to California and have it treated by you.
Well, we're certainly happy to do it, but there was a plastic surgeon in Indiana that I need to look up and give him his name who could certainly do it. The argument has to be made, but it depends on what kind of insurance he has. First of all, does he have a PPO plan that allow him to travel? But second of all, a physician, me or his primary care physician, needs to write a letter to his insurance company that explains the medical necessity for this. And medical necessity doesn't just mean it's a port wine stain or it's a vascular malformation or in this case an angiokeratoma. What you have to write is you have to explain to the insurance company that these are progressive lesions and that unless they're treated, they're going to develop the nodularity and the vascular nodules that Alita Silva referred to in her message to us that we just talked about. Pyogenic granulomas, other sequelae, soft tissue hypertrophy of the underlying soft tissue, lip hypertrophy. So you have to write a good letter to the insurance company to get them to authorize that. I have an advantage in the fact that I'm in the state of California, although there's nothing wrong with the state of California government. At times I don't think there's anything actually right about the state of California government. But one of the good things they did do is that they passed a legislation which clearly defines reconstructive and cosmetic surgery. And there actually is a California statute. I can't remember what the number is right off the top of my head, but it's in my letter. And I actually refer to that in the letter that I sent to the insurance company, that under the California statute, this is the definition of reconstructive surgery, to repair something that is abnormal or as the result of trauma. This is not cosmetic surgery. And since I've been using that in my letters, we found that to be very, very helpful.
That's great. So I can answer Frazil Timber's question. He wants to know if there's a doctor in upstate New York. No, I'm from upstate New York. I'm from Niskayuna, which is near Albany, Schenectady. And anywhere in New York, we recommend everyone to go to Dr. Geronimus.
In New York, NY.
In New York and New York City. And also, Frazil, we have the free laser coming up next month in Boston. It's only a couple-hour drive for you. I'm driving over and running that clinic. You can find it on our website at birthmark.org. Scroll down right on the front page, and you'll see all of our free laser clinics coming up, and sign up for the one in Boston. Larry Fetchko says, are there any new treatment or protocols beyond the pulse dye laser?
Well, there are other manufacturers, other companies there's a device that's being made by Lutronic that is a green wavelength, which is a little bit different. The green wavelength means it's just there's something different on the inside of the laser device producing the green light. This is what's called a solid state laser. Usually it's an ND-YAG laser that has a crystal in it that converts the infrared light to the green light. I don't have as much experience with that. The downsides of the green are it will not penetrate as deeply into human skin as yellow light will. And also green light will be even more absorbed by epidermal melanin. So there are some downsides to that particular technology, and I haven't used it, to be perfectly honest. The next time Roy has one of these things, you can ask him.
Yeah,
because I know he's tested.
He's been using it, and I observed Dr. Soja Puja and DC in May, and she treated one side with the Perfecta and one side with the Lutronic. The patients described the sensation as similar, but the healing was different and the clearance was different. So the pulse dye seemed to clear a little bit more, and the Lutronic seemed to clear a little less, but there was also a lot less purpura on the Lutronic side.
Okay. Well, that again has to do with the pulse structure that we were
Right.
just talking about. So,
Yeah.
I mean, some patients confuse purpura with efficacy. You know, if you use short pulse durations, patients will be bruised. If you use longer pulse durations, patients are not going to be bruised. In fact, today when I did one adult patient, I'd done his previous treatments at shorter pulse durations, and when he woke up in the recovery room, I said to him, you know, Ryan, you're not going to be as bruised today, because today I used longer pulse durations of the laser to target blood vessels of larger sizes.
Great. I love that. I love that whole new approach. Susan Klingbeil wants to know, my son is 6, has a port wine stain on his cheek, neck, and ear. He's had over 25 treatments, laser treatments. He's been under a test study in Madison, Wisconsin, and everything he has been tested for all come back negative on what the doctor thinks may be causing it to be resistant. I'm glad he doesn't have any issues other than this port wine, but our doctor is thinking of maybe a YAG laser, but he's a kid. What do you think would work best on it, seeing we found out it is super deep vessels?
Well, YAG lasers will penetrate more deeply into human skin than yellow light. That's certainly true. That's good in one sense. It's not so good in another sense, in that you're coagulating a much larger volume of tissue. And so that can sometimes lead to ulceration and blistering and necrosis. And unfortunately, I've seen from you, Linda, you've forwarded me several patients that have been pretty badly injured by ND-YAG lasers. So I would be very reluctant to use an ND-YAG laser as a first choice for an infant or young child with a port wine stain. What I would probably do first, since all the genetic testing has come back normal, you know, one consideration could be to be doing a MRI, MRA of the area to make sure there's no deeper underlying vascular malformation. We had a patient at the super clinic 2 weeks ago who came in with a port wine stain. I'd seen her in consultation a couple months ago and asked, well, can you have your primary care doctor order an MRI, MRA? And she did, and she brought the disc in, and our interventional radiologist, Dr. Hasso, read that study, and actually the woman has an underlying venous malformation. So, which means the treatment's going to totally be different. So I think consideration could be given to ordering an MRI, MRA imaging study. And then the other thing that I would recommend is that you look at what treatment parameters were used. I mean, whenever somebody comes to the Beckman Laser Institute after having been treated in another institution, the first thing we look at is what energy densities were used, what pulse durations were used, and what iterations of the device were actually used, as well as the spot size.
Makes sense. I always tell them, you know, different doctors use different settings and different approaches, and you have to just look at it collectively
Yeah.
and review, and you're more than happy to do that.
One of the
So that's
physicians
good.
at the super clinic, I actually had a little bit of an argument with. He said, I always use 7mm spot, and I always use, you know, this energy density. And I said to him, well, why don't you use a larger spot, because you'll get a higher energy density deeper into the skin. Well, no, I like the 7mm spot. That's my go-to spot size. Okay.
So if that's the go-to,
If that's his
the
go-to, that's his go-to.
That's his comfort zone.
That's right.
So Sophia WS said her son Buddy is very grateful to Dr. Nelson. We just saw him this week. Thank you for all your support. So
That was a case that we finally got authorized by insurance. So the family was really, really wonderful and hung in there, and I'm grateful to you and your husband.
great. Mary BZ, Westmoreland. I had one treatment 30 plus years ago. I have a port wine on my cheek. My birthmark has gotten darker over the years. Will a treatment now help with that?
Certainly, absolutely. I have it was the picture of one of our former nurses. She was an oncology nurse. It was on the program of the last conference we did in California, the before and after. She's like a 50-year-old woman.
Yes, she.
Now, it took 15 to 20 treatments, but I mean, other than a minor foundation or a minor base, I'm not an expert in women cosmetics, she almost looks, you know, almost completely normal.
Right,
So
I
a
thought
lot
great.
can be done. It's going to be more treatment, higher energy densities. It's going to be, you know, 1.5 to 2 years probably of treatment, but she's actually given us permission to use her photograph.
Yeah,
So I'll
I've
give it
used
to Linda and you
yeah.
can use it. But
I've used it.
she was on the cover of the program 2 years ago, 3 years, when did we realize?
Yeah, Mary, just let me know where you live and I'll find out who the best and closest expert is, because again, the settings vary and techniques vary and so forth. So David wanted to know, because his birthmark, the one that's the verrucous, is so large, could cold weather be an issue while treatment is in progress?
No, that would not be an issue. This is not being exposed to the skin. No, that would not be an issue.
Agreed. I can't say this name, but Anastasi is the last name. My son, age 6, has port wine on his right leg, sporadically from buttock to toe. When he was a baby, we saw Dr. Nelson and had a couple lasers. We decided not to proceed due to not wanting GA, general anesthesia. It looks the same now. We were also told he may have KTS. He's doing okay. No major size difference. 2 questions. Could he still have KTS? Can laser be done later to reduce the appearance? I mean, also because he said it was sporadic, I'm wondering if it might have been CMTC.
Well, usually, by now he's 6, so I would expect
Right.
most of the CMT to resolve. So the
That's
good news
true.
is from that text, and I don't remember the patient automatically off the top of my head, but the more patients you're really concerned about with KT is when like almost the entire extremity is involved, or 50% plus. If it was sporadic, the chances of your child having KT syndrome is much lower. The only way to make that diagnosis is to order an MRI, MRA, and the radiologist will tell you, yes, there's a congenital absence of the greater saphenous vein, yes or no. And that makes the diagnosis of KT syndrome. There are other genetic tests that you can also do now that are very good for KT, so you could choose one of those 2 options. Certainly you can wait until later to have your child treated, although there is going to be the natural history of the lesion. It's going to get darker, it's going to get thicker, which will make the laser treatment a little bit better. By virtue of the fact that he's now 6, that sort of removes him from the areas that we're concerned about infants having general anesthesia, repeated general anesthesia under the age of 2 or 3. That's really what the FDA guidelines were talking about. It was infants having multiple treatments under the age of 2. So by virtue of the fact that your child is 6, this would be a much safer issue to deal with.
Agreed. Naomi wants to know, can a hemangioma pulse?
Well, hemangioma would be unusual for it to pulse. My first question would be, is the diagnosis correct? I mean, hemangiomas generally don't pulse. Lesions that pulse are what we call arteriovenous malformations. So I don't, who was it that sent that to you? I would encourage them to be evaluated, by a
Naomi
physician.
Ben Brussel.
Well, Naomi, you need to be evaluated by a physician. I mean, I don't know whether this is a lesion on you or is this a lesion on your child.
Right.
I mean, if it's a lesion on a child, okay, hemangioma, but a lesion that's pulsating, I would be concerned is an underlying arteriovenous malformation, and that child needs imaging studies.
Now, the only other exception is the temporal hemangiomas. They can feel a bruit on those.
Yeah,
but they
sometimes
have-
it's right over the temporal artery, yes.
Right. So
Yes.
we don't know.
We need a
where
little
it's-
bit more
yeah,
information.
Right. Frazio wants to know, do adults get put under GA?
Depends on the patient. I did 2 adults today. One has a hemifacial port wine stain, also involves the neck, and the other one was a woman who had extensive KTS that involves her anterior, posterior torso, and her entire left upper extremity. So it's up to the patients. Those patients, we could certainly try to use the EMLA. The only issue is that when you're using the topical anesthetics on large surface areas, you have to worry about the systemic absorption of those topical anesthetics. And there's this phenomenon called methemoglobinemia. I fortunately have never seen this in a patient of mine, but it's been reported in the laser literature, particularly for patients who have had large areas of skin where the anesthetic's been applied for laser-assisted hair removal. And methemoglobinemia can actually result in oxygen desaturation, which is a medical emergency. So, there are the risks and benefits to doing it with the topicals, but I let the patient decide. At the Beckman Laser Institute, we'll do what the patient and their family want.
Thank you. So for those that we need more information on, Gina is gonna post Dr. Nelson and my emails in the string here, so in the comments, you can find Dr. Nelson's email, and you can also find mine. Make sure you send pictures and describe what it looked like at birth and any changes that have happened in between them and treatments. Carista said, help me, I'm already starting to get nodules on my face. I'm in Indiana also.
Okay, well, I have to name the name of this plastic surgeon, but if you're in Indiana, I've driven across Indiana. I would highly recommend that you see Dr. Jerome Garden, who's in Chicago. He used to be on the faculty at Northwestern, but he's now in private practice. So Jerome, middle initial G, Garden, Jerry Garden.
He's on our website at birthmark.org if you just put in Illinois. So he's there. You mean, yeah, right, from Chicago.
Yeah, Jerry Garden.
Yeah. Sarah's got a really interesting question. Do you know of any research done with CBD taken orally or applied topically on controlling or reducing capillary regrowth after laser treatment?
That I have not had any experience with.
Me
now.
neither, but if you have any info on it,
Yeah, well, I mean, we're
Sarah,
trying to get another
send it to
study.
me.
We're trying to get a study going with a company to look at another agent to inhibit the regrowth of blood vessels. I'm hoping we can start the animal studies next month, but that would be topical. That would not be oral. You know, most people are now, because of the accessibility of the port wine stain on the skin, that a much safer approach to do this would be applying something topical.
Okay, that's great. She's in Boston. Well, Mary, sign up for our free laser. Dr. Geronimus, Dr. Anderson, top laser docs will all be there. Dr. Goldberg, and it's next month. So go to birthmark.org. You're right in Boston. It's free. We even have ultrasound that we're offering that day as well. So I hope we see you there, Mary, and you'll get a lot of answers. Paul Doyle Nesbitt, my almost 3-year-old son has a bilateral mandibular port wine stain and has had 2 treatments so far, but they've been delayed in Ireland due to COVID. He got blood test results today, and we were told that he was tested ANA positive. So they said this is indicative of systemic sclerosis, even though he has had no other obvious symptoms that we know of, except frequent temperatures. Can port wine stain cause positive ANA in bloods? I've never heard of it.
Well, ANA to me in the U.S. means antinuclear antibody, which to me means that's a test for lupus, systemic lupus erythematosus. So I think, first of all, we need to, what exactly is the diagnosis?
Right.
And the second thing would be, certainly that child should respond well to laser. For some reason, we've had an epidemic recently of infants with bilateral sort of V3 dermatomal distribution port wine stains that we've been treating very aggressively every 2 weeks with excellent results. So I would encourage you to seek treatment by pulse dye laser. I don't know, unfortunately, John Harper passed away in London. So who are you referring patients to in Britain? Sean Lanigan, my good friend in Birmingham, retired. I guess all my friends are retiring. It's probably time for me to retire now. But they're all leaving. But
Not yet.
I don't know who do we know in London, in Britain now.
Well, we have the Great Ormond Street Hospital.
It's Great Ormond.
And then actually Dr. Wayner is working right now with a doctor in London to start laser clinics there because they are resistant very young, and we're trying to introduce the laser treatments, in infancy. But you can go on our website at birthmark.org and see all of the ones that we have in the UK, because I believe we do have one in Scotland. There might be a place in Ireland, I just can't remember it right now. And if you can't find it, just email me directly. By the way, we have a free laser day, December 9th in Milan, Italy. We often have a lot of patients come from the UK there to see Dr. Coletti, and we're also offering free Sturge Weber consultations with Dr. Pinto and Dr. Comey in Italy, and we're also doing the free ultrasound. So our Milan clinic is getting very busy, but we don't turn anyone away. So it's on the 9th, on Friday the 9th, and you can find that out at birthmark.org. So Roy saying, Linda, could you please let me know who you know in Dallas who knows what he or she is doing? Well, I mean, I'm not sure about Dallas, but I know in Houston, we have
Paul Friedman.
Dr. Paul Friedman's in Houston. He's been closely working with Dr. Geronimus for 20 years. He was his fellow, and he actually goes to New York and learns new techniques from Dr. Geronimus all the time. So I'm very confident, Roy, with you seeing Dr. Friedman. And FYI, we have a free laser clinic in Houston in January that's going to be launched, or maybe launched. You just go to our website at birthmark.org.
There's also Dr. Moises Levy at Austin.
Yeah, but he's
Dell Children's.
pediatrics.
Is this an adult or a child?
Yeah, it's adult. But anyways, that might be good for you to see Dr. Friedman in Houston and get the free treatment, see how you respond. He's got all the lasers and all the tricks. Zishan Ahmad said, do you advise about chest infection? My child, 6 months old, affected with severe chest infection. I don't know what that's related to regarding a vascular birthmark. You have to give us more information
Well,
on
port
that.
wine stains are lesions of the skin. They're not lesions of the lung or the mediastinum
Right.
or the heart or the great chambers or the pleural lining. So again, the question is the diagnosis correct here?
Yeah, well, I don't know if he has a port wine. I don't know because he hasn't said. So Alita's saying, I use Elamax cream on my whole left face to do very well with it. I don't
Yeah.
know, Elamax. Do you know what
That's
that
it's the topical anesthetic cream that we're talking about.
Oh, like at Emla?
Yeah, it's like an amla.
Oh,
There's a lot of different
okay.
trade names. It's
Okay.
2.5% lidocaine prilocaine.
Okay.
But that's for her half face, which is very safe and works well.
Oh.
So she's happy with that, and we'll do it that way. We do it that way.
Great. So Susan says, MRI came back normal, his blood work normal, had 2 doctors do PDL over plus 25. She went in twice with different settings, just doesn't do much. She said target is hemoglobin. I'm not sure what your question is, but ask, because I'm confused. That's a statement, Susan. I don't know what your question is. I don't know what that lasers over plus 25 means.
Is that a follow-up question to something we answered earlier?
I'm not sure. She'll just have to ask the question and send it back. Okay, thank you. Mary signed up for the free laser. That's great. Some people say I am an animal, so sign me up. I love you, Roy. He's got twin baby granddaughters, and they're so cute. So Roy, yeah, just sign up for Houston, and you'll meet Scott there, our COO and our director of our Global Ambassador Program. I know you know Scott. Robin says, hello, thank you for doing this. I used to see Dr. McMeekin when he was in
Tom
Rochester.
McMeekin. Yes, I know Tom very, very well.
Had 2 treatments. There is definitely some I would prefer to be removed. Do you think not? Yes, at age 50.
Certainly.
Beautiful results. And can you just get the ultrasound? Yes, you can come to Boston for just the ultrasound if you don't want laser. Well, we have AVM patients coming just to see the progress of their ultrasound that Dr. Coletti's managing. So yes, come, and you gotta sign up because you won't get a slot. We can't give you slots unless you sign up. So you have to sign up at birthmark.org / it might be Boston, but I'm not sure. You can see it on the front page of our website. Okay, Gabby's watching, and there's all the posts. Viviana's watching. Barb is watching. Hi, Barb Humphreys, our nurse
yeah.
extraordinaire who's
She's
been
coming to Boston.
Yep, she's been treating. She's the leading nurse practitioner in the world for treating port wines for 17 years exclusively. And I've got your folder, Barb. I'll bring that to Boston when you and Dr. Remington come. I look forward to seeing you. Okay, thank you for your answer, Naomi Benbrusso. I continue with my 4-month-old baby at Dr. Boone. Oh, yeah, Florence Boone in Belgium. She's
yeah.
very good, excellent. I'm concerned because it already changed a lot in such a short time. I've already sent the pictures to Linda. Thank you for helping us advise Dr. Boone. Very frustrating that we are always diagnosed with hemangioma. Oh yeah, that's the one that I posted in our international group. That is, there's a question, and Dr. Boone agrees with me that it's not an infantile hemangioma, it's probably congenital, some kind of congenital. I kind of think it's a tufted hemangioma, but we'll see. Dr. Boone will tell you, and you have to let me know right away, because I like to know. All right, so I'm caught up, so that means we can take questions. Also, just as a reminder, next year, the Super Clinic Conference will be back in New York City with Dr. Geronimus. We are considering reinstating the talks because that came back as one of our most requested from doctors and patients, was to have the talks in person. So I'm going to be meeting with Dr. Rosen and seeing if we can do a combo of laser with Dr. Geronimus and then the talks in clinic with Dr. Rosen, like the old days.
Mhm.
So hopefully we'll see about that now that things are getting back to normal somewhat. And by the way, any donation to VBF between now and January 1st, any donation, you get free access to all the talks from the doctors this year. So that's 14 amazing talks, including Dr. Nelson's, Dr. Geronimus, Dr. Coletti, Dr. Friedman. There's a lot of great talks on there, Dr. Wayner. So make a donation to VBF at birthmark.org, and there's a link to get the talks. So, okay, so questions, anything you want to say about, so I guess you can't talk about your research that's coming up?
No, unfortunately, that's under an NDA.
Okay.
We can't,
That's fine.
we cannot.
All right, but maybe we'll have some info soon and some hope. David wants to know, do I need to be in California permanently for treatment? No, you have patients.
No, we have patients.
From all over the world.
Yeah,
A patient came today from Japan, right?
that's right.
So, Susan, okay, so here's her response. For a port wine being so deep and resistant, what laser or what settings? YAG sounds like scarring, which I don't want.
Well, I would not use the NDAG on a child, unless there was just some individual nodularity that I needed to flatten and smoothen out. I would use the pulse dye laser, and the settings would depend on patient's skin type, how thick the port wine stain is, as well as the energy density. So, I mean, that has to be done in person. That's a clinical assessment.
Yes, agreed. So Debbie Star Runyon says, hi from Calaveras County in Valley Springs, California. Can you recommend someone in North California for port wine? I am 70, have had 2 different treatments on the past 30 years. First one in 1983, Argonne. Poor thing.
I would say in Sacramento, Dr. Suzanne Kilmer was excellent, good friend of mine, highly skilled, could certainly do these procedures.
I'm hearing a lot of patients talk about Dr. Kilmer, which I didn't in the past, so I'm getting a lot of good comments. I'm glad to hear you
I know her
say
very
that.
well. I've known her for
Yeah.
25, 30 years.
And
In fact, I'm going to be speaking with a meeting with her in January, so I know Suzanne very, very well.
it's great to hear that. Okay, so Nancy is watching now, ready to take your questions. Debbie said thank you. Okay, David's still watching. So, David, if you came to the Boston clinic, you could get test spots done on that verrucous lesion. So
That actually would be a good idea, because
Yeah.
a lot of people might consider using one of the ablative lasers. When we saw him in consultation, I was doing the cases in the OR at that time, so I was only there for just a couple of minutes. I just stuck my head in the door. But whether the YAG laser should be used, or whether or not one of the ablative lasers like the Argon or CO2 could flatten and smoothen that out. So that actually is a very, very good idea to go to Boston. And, Jerry Goldberg will be there, Roy Geronimus will be there.
Rox Anderson.
Yeah, that's a good idea.
Yeah, so.
Because there's many different ways to treat that.
I mean, if you're gonna fly from Indiana to California, come to Boston.
Come to Boston and
Talk
talk to all of them and get their opinion.
you've already had the ultrasound, but Dr. Coletti's gonna be there, and then all the different lasers. And then you can video it and write everything down, and then find somebody more convenient.
Also, hopefully, you could even have test sites done with several of these different
Oh,
lasers
yeah.
and see which one, number one, flattened and smoothened out the lesion, but number two, which one resulted in the least amount of scarring. Because when you treat those types of lesions, there is unfortunately going to be some scarring associated with that treatment. So it's often, when something like that, to do a test site on a patient so they can see what this whole area might potentially look like after it's been removed.
So again, the Anastasi, I actually was the one that mentioned the CMTC, that's cutis marmorata, telangiectasia congenita, but what Dr. Nelson said was typically with CMTC, it fades out, not always.
Not always,
But it's
usually over
very
time.
marbled looking at birth, and most of them fade out, and most of them are confused with a port wine stain. And, but, you know, the difference is with the CMTC, it's reactive with cold, and with the port wine, it's reactive with, when the patient's warm, it disappears, is that right?
Yeah, they
with the
change,
CMT?
they're very
Yeah.
susceptible to temperature change.
Temperature changes. Katie Branham said, "We will see you in Boston. My daughter is 4. We have not had treatment since COVID. Will my daughter have numbing cream?" She's 4, so she can have it if that's what you want. You can talk to her about it, and Dr. Coletti's there. He's very good with giving a little demo to the child and to you on your hand, letting you feel it, letting her feel it, letting her count, letting her say, you know, what she wants, what she, you know, if she wants to proceed or not. So,
And send a good photograph in advance.
Yes.
So the physicians can plan.
we have that all in our, and I think Leslie will be there too, as a matter of fact, she's gonna be there, so our psychosocial expert will be there. Okay. Does port wine affect vision? I have a big difference in one eye than the other.
Well, if it involves the upper and lower eyelid, there's the potential for glaucoma. About 20% of patients who have upper and lower eyelid involvement can have glaucoma. And so the first thing that I would recommend is that you have a pressure check of your eye and a complete ophthalmological examination. And that was actually we didn't do complete eye exams, but I had one of my ophthalmology colleagues join the Sturge-Weber team at this conference. And apparently there were a lot of patients who had severe eye problems who she was able to refer to specialists throughout the U.S. So that was actually one of the very good things that came out of the conference that we did. But yes, glaucoma is a major issue in anybody who has upper or lower eyelid involvement.
Okay, Debbie says, "I was told that I have a freckle in my right eye. It's due to my facial port wine stain. What are your thoughts?"
Well, I don't know what a freckle is in the eye. To me, a freckle on the skin means a brown spot. I mean, I don't know. I just don't know
Yeah.
what the ophthalmologist is referring to. Does that mean there's on her retina there's just a spot that's a little bit abnormally discolored? Port wine stains can involve the retina. I have a Sturge-Weber patient that I saw just a couple of months ago. We did MRI imaging to rule out Sturge-Weber. He doesn't have any brain involvement, but Dr. Hasso actually wanted me to get in touch with the patient. He wants to use his images in his next book or lecture series because it does show extensive involvement of the port wine stain in the posterior retina. So
Wow,
yes,
that's really
yes.
good. So we are 17 minutes away from ending, so right now I'm giving everybody fair warning to ask your questions before we wrap this up. You know, it's a real privilege for you to be able to hear right from the experts live and ask your questions live. We've now reached over 175,000 views since I started VBF Facebook Live in January of 2017. If you go to the VBF website at birthmark.org and you click on up in the upper right hand corner the YouTube link, you can see all of Dr. Nelson's talks and listen to them until you fall asleep. And
I'm sure they will.
And Dr. Geronimus's and Dr. Wayner's. And if you have any questions about Sturge-Weber, watch Dr. Comey's talks. They're all very informative, especially if you have port wine around the eye. Remember, it's not age dependent. The glaucoma can occur at any time from birth until 100. Okay, so Yana is saying, my 23-month-old daughter was treated by Dr. Nelson during the VBF clinic 2 weeks ago. We will need a quote how much it would cost to come twice a year for her maintenance. Our insurance doesn't cover it, so we've been paying out of pocket. I will email his office. Thank you, Dr. Nelson.
Okay, I don't know. That's between. I have to talk to our ambulatory practice manager. I mean, if there's an issue with insurance denial, the University of California offers major discounts. So I just will have to leave that to them to discuss.
Okay. Thank you for that. Jessica said, just want to express how thankful to have access to this. It's amazing to be able to have it to these experts. It's such a comfort for port wine stain mamas. Thank you, Jessica. And also, if you go on our website at birthmark.org, Click on the picture up at the top. We have 9 circles, 9 for the 9 primary birthmark types that make up about 99% of the vascular birthmarks. And you'll see the port wine stain. Click on it and you will see our amazing frequently asked questions booklet that Dr. Nelson and Dr. Geronimus did with me, and it answers almost every question you could have on port wine stains, and I'm very proud of that booklet.
No, it turned out remarkably well, and we need more of it because we give them out to patients all the time, and it really was very, very well done.
Yep, so we have them now for hemangiomas, port wine, Sturge-Weber, and I just finished writing the lymphatic malformation one, so that'll be ready soon. Jessica Joe said, want to express how thankful, okay, she said that, sorry. Mary is saying, thank you all for this, answering questions and for the free clinics. This is life-changing for me. That's important for the work that we do. Thank you for acknowledging that it's life-changing. Dr. Nelson, oh, sorry about that. There was a question from David. Are you suggesting going to Boston for free laser or a test?
I think, as I said, David, I just stuck my head in there for a few minutes.
Right, I saw it.
I did not do a complete evaluation, and the light was out because you were having your ultrasound. So I saw you in very poor light. I would suggest you go there for a consultation, and if possible, if all those lasers that we talked about are available, I would recommend you have a test with each one of them.
Well, I can tell you the ones that we have two PDLs, a Prima, a YAG, and I believe a CO2 that are going to be available.
Well, then certainly the ablative test site could be done. It would need a local anesthetic, but it could certainly be done.
And Dr. Coletti will be there to do nerve blocks, and we've ordered what he will need to be able to do that. Robin said, will this video be able to watch? Yes, forever. As soon as we finish in like 14 minutes, give it a minute, and then you'll see it pop back up on our Facebook page, but it'll take a while for it to be on our YouTube channel, maybe like two days or something. But if you want to rewatch it, go to our Facebook page where you're watching it from right now, and as soon as I end the live video we're California, it's almost 6, and it's almost 9 on the East Coast. So as soon as I end it, it will stay on our Facebook page for you to watch again. Oh, and thank you, Gina, for posting all the informational booklets that we have that I've been working diligently on to get all 9 of them done in between every other project going on. Also, those of you from Europe, we not only have the free laser in December in Milan, but next June we're in Greece. And Dr. G, Dr. Nelson, Dr. Goldberg, Dr. Anderson, the top of the top will all be there. Candela will be bringing us a couple extra lasers, so we'll have amazing ultrasound and laser clinic and Sturge-Weber in Greece next year. That's not up for registration yet. That'll be probably going up in January or February, along with the New York clinic, which will be next October, Columbus weekend, and Dr. Geronimus and his staff do those free laser treatments. So that's next year. So that's all next year. Okay, so we are coming down the finish line. It is 5:48. We have 5:48 here.
Pacific time.
Right, Pacific time, and 8:48 New York time. I keep looking at my computer because I'm from New York and I didn't change the time on it. All right, so you're welcome, David, and you're welcome, Elida. And again, any other questions? The other thing is, for those of you that are joining us for the first time, it's very hard for Dr. Nelson to give a really good opinion without seeing pictures and getting some more detail. Same with myself. Every day I get emails saying, what treatment can I have for my child's hemangioma? And I look at it and it's port wine. So the nomenclature around the world is still confusing, where a lot of people, won't you agree, are using the word hemangioma. So there's a high rate of misdiagnosis, which is another reason I started introducing in 2018 the ultrasound to our super clinics. And at this past super clinic with the ultrasound, we changed the diagnosis of 8 of the 38 cases we saw. The ultrasound actually changed the diagnosis. In particular, a patient that thought she had KTS and was on sirolimus actually has a port wine stain with some fatty tissue under it, so she really didn't need to be taking this sirolimus. It was just subcutaneous fat under her port wine. So that's very important that we have these ultrasounds and that you get good diagnostic imaging. Everybody calls everything one name, and that's not really what it is. Okay, so let's see. Looking. I hopefully didn't miss any of your questions. I don't think I have, but we have 10 minutes, so write your answers down, get your questions in. Hopefully the next time Dr. Nelson is on here with me, we do it a couple times a year. He'll have some more information on his study that he can't talk about. Melanie threw in a question. Thank you, Melanie, so I can finish out these 10 minutes with some good questions. Can ultrasound impact, where is it? How basic port wine is treated in terms of strategy?
Well, ultrasound will give you information on, number one, the depth of the lesion, and also it can give you some information on the velocity or blood flow through the vascular malformation. So knowing that the lesion is deeper, knowing that the blood flow is potentially higher, that means you're going to need higher energy densities of the laser, and you're also going to need probably longer pulse durations of the laser. So yes, some information from ultrasound can be useful. Most port wine stains are difficult to see on ultrasound because they're so thin and confined to the most superficial layer of the skin. So the ultrasound is really more useful for some of these other lesions that Linda's been talking about, like venous malformations, arterial venous malformations, which are much deeper. There, the information from the ultrasound is very, very valuable.
Well, also, I've had quite a few patients with lymphangioma circumscriptum where it looks like a port wine from a distance. They send a picture and you think it's a port wine, and you look at it closely, you zoom in, and it's the lymphangioma circumscriptum cutaneous, where it's red, and it's a little bubbly, and you get the details. So sometimes it's not a port wine, even if you think it is, and that's the real reason, is the misdiagnosis that we've introduced the ultrasound, that not everything is a hemangioma, not everything's a port wine. Most are. Those two comprise about 90% of our referrals. So, okay, Paula, so, if you're booked for Milan, let us know if you have what your travel restrictions are for arriving in Italy and departing. We're right now working on all the scheduling, and trust me, we can fit anybody and anyone in. There'll actually be 2 laser experts there, Dr. Coletti and another very well-known prominent laser expert from northern Italy will be there.
Just make sure you try and fly into the airport that's downtown, not the Malpensa. I can't remember the name of the airport.
Well, that's the one. Malpensa is the one closest to Laserplast.
Really? Because Malpensa is way, way out of the city.
But that's the closest one to Laserplast.
Maybe if they're outside the city then. But
yeah.
The other one,
I don't know.
there's one that's right downtown.
The address is on the for Laserplast. It's really in downtown. Laserplast is in downtown Milan, right in the heart of Milan. So if there is another airport that's closer, I don't know about it, because I fly into Malpensa from Newark all the time. This is a good question, Robin, really good. Do you find that it is possible that some facial asymmetry, where'd it go, improves after treatment?
So, well, some facial asymmetry will improve after the laser treatment, and one of the things that we've done in patients who've got extra tissue is to employ some of these other things that we briefly alluded to when I think we were talking about that patient David, using the ablative lasers and also using devices called fractional lasers. And we use these routinely to treat scars, burn scars, post-traumatic scars, post-surgical scars, where you put light into the skin and you deliberately heat up the skin to shrink it. And so for some patients who have asymmetry, that could actually be very, very helpful. I know I've done that with the fractional devices. I know in New York, Dr. Geronimus actually does that with microneedling. But it's the same thing. You're putting something into the skin to generate a lot of heat underneath the skin to shrink and tighten the collagen. So yes, some facial asymmetry can be improved.
And question I want you to be able to answer is for the patients that have some ulcerations and burning or hypopigmenting from the laser. Can that be fixed?
Yes, with the fractional lasers, absolutely.
Okay, great.
Absolutely.
Great. Melinda just joined. She said, "Hi, my son Bennett is a patient of Dr. Nelson's. We've taken a break for several months now." Melinda Anderson. And she said, "I may have missed this, so I apologize, but anything new coming for stubborn port wine stains?"
Well, just changing the pulse duration of the laser exposure and using higher energy densities.
And you're not using a gag because they're children.
No, that child has a very flat, light pink port wine stain on the cheek. I don't remember which cheek, but
So if
no,
it-
that would not be a candidate for the YAG laser.
But, I just want to throw this out because, Dr. Mim used to tell us that these port wines that are super, super, super resistant after multiple treatments need to be examined to see if there's an underlying AVM. If
Well, we
it's a
actually did. We worked
Oh,
this
okay.
child up completely.
So it's not a
The child had an
CMAVM.
MRI, MRA in
Okay.
St. Louis,
Okay.
and it's all totally normal. I mean, sometimes some of these light port wine stains can be very difficult to treat because there's not a lot of blood in the port wine stain. There's such a light pink color. I mean, the easiest port wine stains for me to teach the residents and fellows to treat are the dark purple ones because there's so much blood, there's so much absorption of the light, you can see the effect of the laser treatment immediately. Whereas in some of these lighter port wine stains, there's not enough blood to absorb enough light to generate enough heat. So those sometimes are the most challenging cases and the most frustrating cases as well.
Well, and I'm hoping too, Dr. Nelson's not participating yet in it, but I'm working on this Yale study of thermal regulation, trying to passively, without any surrounding tissue destruction, to have a thermal effect and try to engorge the vessels more. We're seeing in the two piloted areas some good results right now, but we're not ready to go full yet until we work this out. But there's always something coming. You're working on a study. We've got the study at Yale. Robin wants to know, did you find any sinus or dental issues in patients with facial port wine? Absolutely.
Absolutely.
That's why we bring Dr. Darrow,
Yeah.
who's a leading dentist in the country for gums and oral involvement of any vascular lesion, and then Dr. Fenn, the orthodontist. So at our super clinic just this year, we did 27 dental exams for anyone with oral involvement. So we offer that every year. Okay, so we have 3 minutes left, and I don't want to cut anybody off during the middle of a question. So if you have any questions, and again, all of you that are still on and watching, you can go back and watch this, and if you're like, what did Dr. Nelson say, what did Dr. Linda say, and it stays forever. We have them from back in 2017, and you can go back and hear Dr. Nelson's comments and Dr. Geronimus from all the way back then. Let's see, let me just go through. So once more, anyone looking for free laser, and again, we only do free laser when it's somebody we know is a super, super expert. So we have it next month in Boston with 6 or 7 top laser experts. You can't go wrong. And then we have it in December in Italy with Dr. Coletti and another laser expert. You can't go wrong. And then in January, we're in Houston with Dr. Friedman, another expert. And then in May, we're back in DC with Dr. Soja. So you have lots of opportunities. And then October back in New York for free laser. Any tips for skincare routine for facial port wine, particularly for toddlers?
Well, not really. I mean, immediately after the treatment, we tell the families to keep it moist just in case there can be some minor scabbing or a little blistering. The most important thing we've already talked about is really ultraviolet light exposure. You want that skin as white as possible. People like to use the blue lizard. My wife put blue lizard on all of our kids. That's good, but sunscreens are full of chemicals, and I don't like to use them a lot in infants and young children. I tell parents, just put a big goofy hat on and just keep them out of the sun. I find the sunscreen sometimes can be annoying, and a lot of patients can be allergic to the sunscreens. And about 20 to 25% of patients with port wine stains can actually get eczema, which is like an irritant dermatitis. So if you're putting a sunscreen on that can actually make that worse. So my recommendations are just a big hat, ultraviolet light exposure, but not necessarily a sunscreen.
Thank you for that. And remember, what he's saying is, it doesn't matter if the sun's out, it's the light, the ultraviolet light,
Yeah.
which is present, whether it's sunny or cloudy. So they should always wear a sunscreen. And our doctors in our Healthy Skin Project are recommending zinc oxide.
Yeah.
So-
Transparent zinc oxide,
and-
or just wear a big goofy hat. I have a big goofy hat that I wear during COVID. I was confined to my backyard and my pool. My wife went and bought me this enormous hat from Armstrong's Garden, and I wear it all the time. So.
Okay, final question. Gail says her 16-year-old has had many treatments with Dr. Friedman, but only about 4 times over the last 8 years. How often should he do to maintain it, his skin health? He has most of his face and all of the left side of his body.
Well, that's an extensive lesion, and I can't. I mean, if he's got nodules that are developing, those should be treated promptly because they're only going to get worse. But probably for your son, I would probably recommend a maintenance treatment probably once or maybe even twice a year to maintain it, because these lesions are progressive. You said your son is 16. If he's going through a growth spurt, that means his port wine stain is going to get darker. That happens with all children or with changes in hormonal status. So he might need a little bit more closer number of treatments with laser while he's going through his teenage years, particularly if he's going through a growth spurt.
Thank you very much, Dr. Nelson. It's
Thank
been
you.
a very busy, active, and phenomenal session. I look forward to hearing about your research study. I know that Dr. Coletti's initiating one as well, and I'm looking forward to hearing about that. We're always trying to bring all of our families the latest and most current information, and also when we hear about the problems, we'd like you to know about them because we want to avoid any problems. So if we hear of anything that's bad, we want to let you know. If we hear of anything good, we want to let you know. Check us out at birthmark.org. Next month we have a fashion show in New Jersey. If you're in the area, come. You can find it on our website. Or if you're in the Boston area, come for free laser. If you're in Europe, come for free laser in December, free ultrasound, and free Sturge Weber. So thank you again, Dr.
You're very
Nelson.
welcome.
Thank you all. God bless and stay safe.